Yo, YouTube Live, first ever YouTube Live. So let's kick it off. Get more people on here. Let's kick it off. All right, first question. Let's see. Live chat. Let me sort this out. All right. Okay, let's go. Let's go. Enough messing around with you guys. What's up, guys? Let's go more people on here. 6 o'clock. All right. So from this is mostly questions from Instagram. Who's the best support worker you've ever met? Best support worker I've ever met. Support workers in theaters. There's been a lot of them, but one guy that stands out is a guy called Adam. I worked with him in the Isle of Wight. How old are you? I am 30 years old. I turned 30 on the 23rd of May. Question, getting hit in the head, does that decrease your IQ? So yes and no. It depends. So if you have repetitive head trauma, you can actually develop a type of dementia called dementia pugilistica. This is what Muhammad Ali had. And obviously you get dementia and you lose your kind of higher cortical functions. What's your sexual orientation? From Avishka. I'm a heterosexual, so I am straight. What body hair do you remove? These are weird questions. Beard mainly and hair. Can vitamins clash with each other? No, they can't. What was the hardest surgery you've ever done? The hardest surgery I've ever done was basically, it's called a laparotomy and a descialysis. So what this was for someone who had bowel obstruction, so their bowel was blocked, okay? And because of previous scar tissue and previous surgery, and they had cancer throughout the bowel as well. So basically it was a long operation, big cut in the middle of his abdomen, and we had to take apart each individual scar tissue. That took about 10 hours. It was the hardest operation I've ever had because it was 10 hours long. I've never been in an operation for 10 hours, so it was a mentally, emotionally, and physically fatiguing operation. Hello to all my fans from YouTube, TikTok, and Instagram. Go follow me on all socials if you haven't already. How long have you been a doctor? I've been on for 7 years. I'm going to be doing questions from both. Do you regret becoming a doctor? From Abdul Amir. I don't regret being a doctor for 1 minute at all. It's the best thing I could have ever done. I can't imagine doing anything else. What was the hardest year in medicine? The hardest year in medicine was no doubt last year. So last year I became a specialty registrar, which means it's a higher surgical trainee. It's the next jump up and it's the next step in my surgical pathway. And it was tough. I wasn't ready for the amount of work, the responsibility, the amount of extra operating I was going to do on my own. So that was one of the toughest years I've ever had. What would you say to non-COVID believers with a possible new surge coming? Coronavirus is real. I've had coronavirus and it's not good. What is your age? 30. What emotions did you go through during the COVID peak? Basically stress, exhaustion, and anxiety. So, don't worry if you've had that as well. Did you get into med school straight away or through a different course? I got into medicine straight away and it's a long haul. What courses have you studied? I've done a medical degree and I've done a BSc in hematology. That was during my studies. Skincare and pimples. So I don't really have a skincare routine, but what I would say is you need to sleep well. One of the compounds in our skin which is important in maintaining skin tone, skin volume, and elasticity is elastin and collagen. These are both proteins. They are broken down when there's increased cortisol in our bodies. And if you have a lack of sleep, you will have increased levels of cortisol. So make sure you sleep well and stay hydrated. Those are the two things I can advise you. And regularly change your pillow sheets and bed sheets because they carry lots of germs and they can affect your skin and block your pores. Okay. Do all your posts in videos in Insta, as we don't have TikTok. For people from India watching, I am going to put all my content on Instagram as well. Why don't you read DMs? I try to read DMs, but I get loads. I'm reading these I'm reading all of these from my story replies that you guys have gave me. So that's all you guys. Near-death experience of patients. I've had death experiences of patients. Near death, you could say, when a patient's had a cardiac arrest and we bring them from basically death to life. That I guess that's a near-death experience. How to be smart like you? I wouldn't consider myself smart. I have worked hard, and during, the culmination of my knowledge has come from just years of experience. I've been a doctor for 7 years. I've been a medical student for 6 years. So I've been studying medicine for about 13, 14 years. And before that, I've done several years of biology, chemistry, etc. So I've been immersed in science for over 20 years. So yeah. Can hiccups kill you? If yes, then how? Hiccups themselves can't kill you, but what causes a hiccup can kill you. There are some hiccups that are caused by a subdiaphragmatic collection, and that could be potentially fatal. How to grow your penis with fruits or other ways? There are no ways that you can grow your penis with fruits, but there have been some studies linking watermelon, and watermelon contains citrulline, and citrulline can be converted in our body to nitrous oxide, which can increase blood flow to the vessels. One of the vessels it increases blood flow to is obviously the dorsal arteries in the penis, and there's some transient or tangible link between the two for erectile dysfunction. What requirements do you need for med school? Good CV, some evidence of charity work, a good med school interview, and an interest in science. The scariest thing in your profession. The scariest thing in my profession, losing a patient during surgery. When something goes wrong during surgery, you have to act quickly, otherwise it can go wrong. Do you watch anime? I actually do watch anime. I watch a lot of anime, and I'm not ashamed to admit that I watch probably a bit too much for a man my age. Yeah. So, I still watch anime. Right now, what am I watching right now? Well, I'm finishing season 3 of JoJo's Bizarre Adventures. So yeah, I watch a bit too much anime. Were you taught about nutrition in med school? We're actually not taught too much on nutrition. We are taught a little bit about the fundamentals, but I think that's a serious thing that's lacking in med school. Certainly in the UK, I don't know how med school does it in the USA or elsewhere in the world, in India, for example, but I know in the UK, we don't get a detailed kind of insight into nutrition apart from the basics, and that's something you need to learn for yourself. That's something I learned for myself kind of throughout my career, and a lot of doctors actually don't have that knowledge. And if you're enjoying this live and me going through these questions, please tell your friends, share this live so we can do it. I'm going to do this live until we get through all of these questions. What made you become a doctor? So 2 things made me become a doctor. One was obviously my mum was an inspiration to me, and she is a doctor as well, and she inspired me. Kind of hearing her stories, I wanted to kind of be that hero. And guys, oh, yeah. So, what was I gonna say? Yeah, she was kind of like inspired me to kind of do all that kind of stuff and get into medicine. But also when I was growing up, I had a neighbor who lived near me who had a spinal deformity, and I was very close to her, and it was a congenital spinal deformity, which means she was born with that. And I get a little bit emotional when I think about this, and I always said, I'm going to grow up, I'm going to fix your spine. Luckily, she received surgery and treatment for that well before I became a doctor. But yeah, that was another kind of drive for me. Have you ever delivered any babies? If so, do you have any advice for women due to give birth? What I would say, the best advice I can give is listen to your midwife and obstetrician. They have probably, no doubt, got countless of years of experience. Don't believe stuff you read on the internet. Midwife and your physician, listen to them, and listen to your body as well. And listen, a lot of women think that, it's harmful to the baby to take pain relief or have an epidural during birth. I think you need to listen to your own body and listen to your midwife and physician if that's something you're going to do, because, not that I can say I've been through it, but it's a painful experience. I have delivered babies not as a doctor, but as a medical student. We need to go through rotations, and one of the rotations I went through was obstetrics, and in that we had to deliver 15 babies to be signed off. So it was a tick box exercise for me. 15 babies I had to deliver, 10 vaginal deliveries and 5 via C-section. Advice for teenagers who want to go into the medical field. Again, good CV, do some charity work, and read up some medical topical stuff as well. Have you ever been to India? I go to India like once a year. Where do you work? I work in the UK. So I'm answering both of these questions on live here and on here. Most complicated surgery you performed, probably the 10-hour one that I mentioned before. 10-hour for a blockage of the bowel. It was so mentally exhausting and physically exhausting as well. I was dehydrated. I needed to pee. I just needed to sit down and relax. And it was at the end of a long day. So I was getting into the 20th hour of my shift. And I only have a 12-hour shift. What causes a perianal abscess? A perianal abscess is what it says. Peri meaning around, anal meaning bum, abscess is an infection. So an infection around the bum. So it can be mainly it's because of a blocked kind of hair follicle or gland, sweat gland, which is causing that. What happens when your pee is yellow for 3 days? So pee can be various colors. If it's clear, it probably means you've got good hydration levels, good amounts of water. If it's dark yellow, almost like amber, it means you're dehydrated. And if it's red, either you've been eating too many beetroots, or if you're a beetroot-free diet kind of person, it's probably blood. You should see a doctor if it's persistently red. What are the instruments you use during surgery? Now, instruments used during surgery, it varies what type of surgery. The instruments we use for a gallbladder removal might be different from the instruments we use for a hernia repair. And we've got different sets, major sets, minor sets, gallbladder set, hernia set, skin set, so many different types of equipment used depending on the type of surgery, but usually you will have to have stitch cutting scissors. You will have something called a Macindoz, which is a type of curved scissors to clear tissue. You will have various types of forceps, tooth forceps to grab skin, DeBakey's non-tooth forceps to grab bits of bowel, Langenbeck's, these are little retractors that you use. So various types of instruments that you can use, and even for breast conditions, use different types of tools. Can humans be telekinetic? Now, there's no science behind telekinesis, but I'm convinced there might be something psychic. I don't know. This is the optimist and sci-fi kind of inner sci-fi kid in me. I don't know. Why do we have hiccups? Hiccups usually are caused by some sort of irritation of the diaphragm, diaphragmatic irritation that can be from the chest side. You've got some sort of chest or chest cavity thing causing irritation of the diaphragm, or it can come from the abdominal side. Can you just quit YouTube and TikTok and just be normal and do your fucking job? No. So no, the answer to that is I'm going to keep doing my TikTok and my YouTube. So you can suck it, whoever that was. How different snake venoms work. Now, snake venoms usually block the kind of neurotransmitter release, and they break it down. So the synapses between the neurons don't actually function anymore, and you can go to sort of muscle paralysis. That's how most of them work, and you need an antidote ASAP. Now, depending on the type of snake bite, it may affect different types of neuroreceptors, so make sure, you need to seek urgent treatment, and that's why some snake venoms are lethal, because we can't find out what exactly the snake venom was. All right, what's the happiest moment for you during work? Now, sometimes the happiest moment for me during work is the end of my shift, because I'm absolutely exhausted. But often in work, the best things for me is actually breaking good news to patients. And one of the highlights throughout my career, especially as a cancer surgeon, has been giving good news to patients about a successful operation, about saying that they're cancer-free in clinic. Those are some of the highlights that, I can consistently say to people, and, it brings me no end of joy. And it never gets old. Imagine saying to someone that they're cancer-free and they get an extra 20, 30, whatever years with their family. Let me tell you, it doesn't beat that. If you're going to become a doctor, that's one of the main reasons. You can just give good news. Does diabetes cause rotting body parts? No, diabetes itself doesn't cause rotting body parts, but what can happen, this is how diabetes can result in gangrene. So with diabetes, it can cause something called diabetic neuropathy. This is when you lose sensation to various nerves. For example, you can lose sensation to your fingertips or your toes, and you might bash your toe somewhere and get a small wound, and which you may not notice. The wound can get infected, and because diabetes causes immune suppression, the wound takes longer to heal, the infection takes longer to heal, can get worse, and can result in gangrene, necrosis, that means cell death, tissue death, and it can die. Talk about your family, doc. I will do. So I am an only child. I don't know if that comes across. Let me know if that comes across. I'm an only child, no brothers or sisters. So I am greedy, I am selfish, and I am attention seeking kind of guy. That's me. How do you not get sick from prodding people's organs? Now, you know what? It's an interesting question. I've never really thought about it that way. The kind of stuff I do, I have my hands deep in people's organs all day long. And that's not weird to me for some reason. That is actually pretty weird now that I think about it. Objectively, it's very weird. And I just don't know. Some people, blood and the sight of guts is probably enough for them. And they probably won't end up being surgeons. But yeah. Does it stink when opening up people's bodies? Not always, it depends. If there's death inside, like dead bowel, dead tissue, then it will stink of like feces, blood, and just death. But yeah. Is it normal to sneeze when I eat raw onion? You shouldn't sneeze, but your eyes will definitely be watery. Do you ever want to do anything besides being a doc? I love being on social media, and that's from Craig Milne. I love being on social media as well as kind of being a doctor, educating. So that's it, really. I love doing that. Why do stinging nettles hurt? Stinging nettles, I did a video of this on TikTok. If you've not seen it already, go check it out. The reason stinging nettles hurt is because they've got tiny little kind of needles all over their leaves. On the leaf, they've got tiny little needles, and basically they just kind of jab you when you brush past. They break off and jab past you, and they inject a cocktail of kind of serotonin, and they cause a dopamine spike. And basically, when that serotonin cocktail is injected into your skin, it produces pain. Have you ever worked with patients who have cauda equina syndrome? I've seen a cauda equina a few times, but mainly when I was working in orthopedics a few years ago when I was more junior. And cauda equina is scary. The patients come in with paralysis. Often they've just defecated themselves because they've lost control of their bladder and bowel because of some lesion sort of compressing their spinal cord. And basically, it can be permanent paralysis if they're not fixed immediately. They need an urgent spine MRI. It's scary, guys. Do we need to brush our tongue? We do need to brush our tongue. Our tongue also is lined with bacteria and germs. And to have good oral hygiene and a good breath, as well as brushing your teeth twice a day and regularly flossing between your teeth, you need to brush your tongue. Do not forget that. I'm not a dentist, but that's something I can definitely tell you. Can we die from water? From Marion Bin 6 OK. You can die from water. Excessive water can cause hyponatremia. That is a dilutional effect of sodium salts in your body, and it can result in death of cells because they just burst because of osmosis. Too much water goes inside them and they burst. If you're drinking like 6 liters of water in a day, that's not good. Which plants can heal you? It's a good question. Plants across nature have lots of healing properties. For example, Belladonna atropa, also known as the deadly nightshade, contains atropine. Atropine is used to increase the heart rate and is used in bradycardia. That's a pulse below 60 beats per minute. Opium, raw poppy seeds can be used to derive morphine, codeine, which are used in pain relief. The English yew tree, the common hedge, contains these alkaloids which can then be chemically synthesized to produce anti-cancer drugs. And for example, the willow tree, the Salix species of the willow tree, the bark of the willow tree contains salicin, which the body then converts to salicylic acid, which is a precursor to aspirin. Aspirin is used as pain relief, as a clot buster in heart attacks, in strokes. The list is endless. Tips for weight loss. One tip for weight loss is calorie deficit. Reduce the amount of calories your body requires, either by exercising or moving more or eating less than your body requires. What's the weirdest places you've seen hair grow? Weirdest places I've seen a hair growth is in someone had a lump in their skin. We removed the lump and it grew teeth and hair. It was called a teratoma. Yeah. What is the most painful disease? The most painful condition that has been reported in medicine is probably trigeminal neuralgia. Now, this is a very rare condition, and it can it's known also, it causes like kind of, it drives people sometimes to commit suicide. Look it up. I did a video on trigeminal neuralgia. It's a crazy, crazy medical condition. Which med school did you go to? I went to Imperial College in the UK, and I would recommend it to anyone going to medical school. I had fun there. It's in London. I just had an absolutely great time there, and it was tough, but I loved it. How do you have a work-life balance? It's sometimes thought it's very difficult to have a work-life balance as a doctor, but it's not as hard as it seems. You need to prioritize. So for example, I do lots of research. I'm on social media, on Instagram, YouTube, and on TikTok, as you guys may be aware. So I'm across all of those platforms. I also have to meet up with my friends and family. I also have to go to the gym. I've also got a full-time job as a surgeon and do night shifts and do on-calls. And I need time just to watch Netflix and chill out. So I do all of those things. I've only got 24 hours in a day. Sometimes it is too much and I have to push it to the next day, but you will find time if you prioritize. If you want a doctor, what job would you have picked from Sinks7662? Good question. I would probably be something to do with languages. I speak English, Tamil, German, and Hindi, and I'm learning Spanish. And I used to speak a little bit of French when I was in school and uni. A bit rusty in that now. So I speak a few languages, and I just love languages. And in school, I did Greek and Latin, and I absolutely loved it, and I was good at it as well. Why did you want to become a doctor? I answered this earlier. My mum and also my neighbor who had a spinal deformity pushed me towards that career. Can a pharmacist be in a team of nurses and doctors in the hospital? Pharmacists are crucial to a hospital. And running a good team. They pick up medication errors. They provide insights on what side effects medications can have. They pick up things. They're just awesome. What happens when a drink, colloquially speaking, goes down the wrong pipe? When a drink goes down, so listen, your trachea, which is your windpipe that's lead to your lungs, and your esophagus, the food pipe, the first part of your alimentary canal, they're just so close to each other. And sometimes food can slip into your breathing pipe instead of your food pipe. And that's what going down the wrong pipe is. Hello from Scotland, what up? Where do you live? I live in the UK. Why don't you go private? You can't go private until you finish your surgical training. I'm, about 3/4 of the way through my surgical training. So once I finish, I will do private practice as well as being an NHS doctor. But yeah. How did you come up with the idea that you wanted to be a surgeon? From Pranzi 101? I wanted to do something practical, fast-paced, and hands-on. So I decided to go into surgery. How do you stop yourself from crying? Don't stop yourself from crying. When you cry, and tears are a form of catharsis, and they're also a type of natural painkiller. When you cry, you need to cry sometimes, so just do it. Do you have any phobias? I have the fear of failure and letting my parents down. Those are the two biggest things and drives in my life. Phobias are not a bad thing unless they're stopping you from doing things. So if you have a fear of something, phobias are an innate human nature to prevent us from getting harmed. For example, people are scared of spiders. Some spiders are poisonous, so it's an innate natural thing for humans to have fears. Interesting fact, when humans are born, we only have two fears: the fear of loud sounds and the fear of falling. And then we develop all other fears. We acquire other phobias as we age through experience. So actually, we only have two natural fears: of falling and of loud sounds. And everything else we acquire. So it's all up here, guys. Can we still live even without our sexual organs? Yes, you can. So if you have a cancer, testicular cancer, ovarian cancer, cervical cancer, often you'll have to get these reproductive organs, sexual organs removed, and you can still function without them. You might lose a bit of testosterone, estrogen, etc., and that might affect the bone function, muscle function, etc. Because testosterone, estrogen are important in kind of bone density, muscle strength, etc., mood, libido. So that may be affected, but it won't actually affect. You won't die from losing your sexual organs. Do you recommend being a doctor? 100%, 100%. Do you have kids? None that I'm far as I'm aware. What was your hardest subject in your medicine years? I hated pharmacology. It was so tough. So I hated that. Is masturbating harmful? No, it's not physically harmful, but if that's all you're doing all day without stop, might be a bit of an issue. How's kidney made? You need to take an embryology course. It's just formed during in utero. How does it feel to lose a patient? I lost one of my patients in my first week as a medical doctor, and it was tough. It was tough, and it will live with me forever. I remember I was at lunch. I got a crash call on my pager, and I ran. We gave CPR to this patient for about 20 minutes, and we ended up losing the patient. And it was one of the toughest moments I'd had in the first week, and it lives with me forever. And I was beating up myself because I thought I could have done more to fix this patient. I'd known this patient for a few weeks, so we'd formed a sort of bond. Yeah. Can sleep deprivation actually kill people? Now, I would say yes, but I don't think anyone's been awake long enough without sleep to actually occur. So two things about that. The Russian sleep experiment did not exist. That's a fake story. Number two, there's a guy called Randy. I can't remember his surname anyway. There's a 16-year-old student or kid in the USA in the 60s, Randy Lerner, I'd like to say. He went without sleep for 14 days, a bit over 14 days. And he developed psychosis, delirium, loss of focus, loss of concentration, irritability, mood swings, etc. And lots of problems happen when you don't sleep. I talk about sleep a lot. Your immune function drops. You lose muscle strength, you're more prone to pick up infections, your cortisol level spikes, increased risk of heart attacks, increased risk of dementia, because when you sleep in your REM sleep, the brain increases cerebrospinal fluid. This is brain juice and helps to wash out the harmful toxins, including some of the toxic substances like amyloid, which can build up and actually cause Parkinson's and dementia. So you need sleep. Regrets when you're at med school. One of my biggest regrets at med school is I didn't join enough societies. So yeah, that's one of the biggest regrets. I loved drama and I loved acting when I was in school, and I didn't join drama club. That was one of my biggest regrets, to be honest. What do you do to stay grounded and mindful? Every day, just for 5 minutes or 10 minutes throughout the day, just do absolutely nothing. Don't go on your phone, don't watch TV, just kind of stand and look outside, look at the sky, just kind of meditate something. You just take 5 minutes to yourself every day, do nothing. You owe it to yourself to do nothing. Switch off all your stressors for 5 minutes. Do that. Try that and let me know how it is. Hi from Sydney. Are you a registrar? I am a registrar. I've been a doctor for 7 years. I've been a core surgical trainee, so I've done my core surgical competencies, and now I'm doing higher specialty training. I've done all my basic jobs, everything. So I'm purely just a surgeon now. I've done all my surgical exams. I just need to continue my training for another couple of years, and then I will be a consultant. What's the most deadly surgery to perform? I would have to say vascular surgery or neurosurgery are pretty tough. But yeah. Why is sepsis deadly? Now, sepsis is a very important topic. Sepsis can kill. This is a bloodstream infection. And we always talk about sepsis a lot because it can kill so rapidly. That's why you need to give urgent fluids and antibiotics within the first hour to save someone's life. It's basically the infection has got into your bloodstream, and once it's in your bloodstream, it can affect anything from your brain, heart, kidney, lungs, liver, anything. So it can be deadly. Do you recommend being a surgeon if you want to be a doctor? Now, surgical life isn't for everyone. There's no predictability in surgery. Sometimes you might be operating till 9 p.m, but your shift finished at 5 p.m. because if a surgery takes longer than expected or there's a complication, you might be in hospital for longer. You're sometimes always worried about patients after the operation. Have they got a complication? Did you do something right? When you make a mistake, you carry that mistake with you forever. Well, not forever, but for a long time. And it's very competitive as well. So you need to get awesome grades. You need to do extra stuff, research, publications. So definitely think about whether surgery is right for you. Do some experience in surgery when you're a junior doctor, when you're a med student, do some attachments in surgery. See if it's for you. It's not for everyone, but it's an incredibly rewarding career. But nothing that's worth having is without its pitfalls and without its own little kind of downers as well. So everything has pros and cons. You need to see if surgery is right for you. What disease kills you the fastest? Rabies is up there, has almost 100% mortality rate if you don't get treatment for this. What happens if you drink energy drinks every day? If you drink energy drinks every day, depends if they're high in calorie or if they're sugar-free and 0 calorie. But either way, you should not be purely basing your entire fluid intake on energy drinks, but they're not fatal or as bad as the media hype it out to be. All right, so that was the first lot of Q&A. I'm going to go through the next lot now on my Instagram stories. All right, let's see what we got here. Okay. Hold up. Sorry, guys. Why do I have an allergic reaction to being tired? Not sure. Allergic reaction to being tired. What do you mean? You need some specifics on that. Okay. We got these more questions. What is peripheral neuropathy? Peripheral neuropathy, so peripheral nerves in your fingertips, toes, etc. And neuropathy means reduced function or dysfunction. So that's what it is, like a numbness essentially. Is burning too much incense bad for your lungs? Well, incense produces smoke, and if you're inhaling lots of that smoke, it can be harmful and it can cause irritation. Your native place. So I was actually born in India, in Mumbai, and I moved to the UK when I was 5 years old. I moved to India via Hong Kong. I lived in Hong Kong for a year, and I lived in Nairobi for a year as well. Let me know which part of the world you guys are from. Comment on here, share the live on here, and also head over to my Instagram and to TikTok and give me a follow on there. I had weird urge to eat paper. That's something called pica. Do you grow veggies at home? If you've not checked me out on Instagram and on TikTok, you would miss the fact that I'm growing a vegetable patch at home. I've got loads of veggies at home, mainly lettuce, a lot of beans, and some oregano and basil as well. Difference between type 1 and type 2 diabetes. Type 1 diabetes is basically something that you're born with, and it's a type of reduced insulin, lack of insulin basically, and type 2 is insulin resistance, and it's linked with obesity. Why are my periods so light compared to others? Periods can vary. Sometimes some people can have heavy periods, and that may be linked to conditions such as PCOS or endometriosis, where they have particularly heavy periods, and some people just have light periods. And the pain of the periods is linked to the amount of production of prostaglandin, which is a type of chemical hormone which is produced that increases the contractility of the uterus muscle, which sheds the lining. Is it bad that I sleep on my stomach? Sleeping on the stomach is actually quite an uncomfortable position, but if it works for you, it works for you. Is it possible to make a super baby? Now, back in 2018, I think it was, there was a Chinese scientist who genetically engineered 2 Chinese embryos to be resistant to HIV. Now, the gene, the CCR5 gene, which also switches off the gateway to the HIV virus, also has some link to intelligence levels. So these babies were thought to be resistant to HIV and super intelligent. So it's a little bit controversial, and this scientist was then put in jail for doing that, and it's a very controversial, but I think in the future definitely people are going to be doing more designer babies, because if you think about it, if we can identify genetic conditions in the embryonic stage, or even before that, we might genetically modify babies to not have certain diseases. And when we start getting into genetic modification, that will then switch off other genes, off-site modifications, off-site targeting. CRISPR technology is growing every day, so it's gonna be a scary future. 2 + 2 = 4. Even I know that as a surgeon. Can you dance? I can. Everyone can dance, but not everyone's good. I'm in the category where I can dance, but I'm not very good. But I'm not ashamed to admit it, and I'm also not ashamed to dance. But you definitely won't want to be associated with me when I dance. What activates the funny bone? We actually don't have a funny bone, although, well, the funny bone is actually a nerve. It's the ulnar nerve, which is under the uterus, and not uterus, humerus, sorry. And when we bang our elbow, basically that ulnar nerve is compressed underneath the olecranon fossa, the elbow, and it gets pinched, and that causes that tingling sensation. What is the best thing about being a doctor? The list is actually endless, to be fair. Working with a great team, delivering awesome news to patients, just getting that satisfaction of a patient being discharged and healthy. So many things. Why are bruises different colors? Now, bruises are different colors because of different stages of healing, and it's to do with the bilirubin breakdown, which is in your red blood cells. I'm going to do a video on this on TikTok, so if you're not subscribed already, go and watch it on TikTok. Let's get to some more questions. How can I stop my hair thinning? I'm 16. There's various causes for thinning hair. It could be because of an infection of the scalp, it could be because of alopecia, or you're wearing too many hats, or it could be just, a genetic thing. But yeah. How can I get rid of a tummy as a teenager? Now, weight gain can be common, especially in the teen years, hormonal fluctuations, but the best way to reduce, you can't spot reduce body fat, you can only reduce your calories. But as a teenager, you need to be careful of reducing calories too much because you're at the growing stage. You don't want to be suddenly restricting all your calories, so it needs to be careful. And if it really is bothering you, you might need to get in touch with a dietitian, nutritionist, or your doctor who may be able to assist you safely with weight loss. Any jokes at work? All the time. I'm lucky in that this year I've had a really, really great cohort of people to work with, really great group of people to work with. I've had so much fun. I've made friends for life this year at work. Toilet and surgery, who covers you? Now, fortunately, if you are bursting for a pee, you can go for a pee because it's not safe for you just to hold in your pee during surgery. If you're working with someone, you can do that. It's not a big issue, as long as the patient is stable. What sort of plants do you grow? Lettuce, beans, basil. What else do I grow? Spinach, mint. Favorite memory while being a doctor? Probably my first day of being a doctor, introducing myself to everyone, introducing myself to patients and being called doctor, and that was just great. It will stay with me forever. And yeah, I can reminisce, and I love that. I love that. What are the consequences of removing a gallbladder? Well, the gallbladder stores bile, which it's useful to help us break down fatty substances. So when we remove the bile, we get the bile production directly from the liver. So you might have some runny stool because the fat isn't digested as well. So you might have runny stool for a while. That's the main thing, really. Otherwise, if you need gallbladder removed, you need your gallbladder removed. Is a low carb diet healthy? Now listen, the brain, 75% of the brain's energy is dependent on carbs. I don't like a low carb diet because it makes me feel tired, cranky, and irritable, and my bowels are affected as well. So I like carbs, and carbs are fun to eat. Now, if you're trying to lose weight, you just need a calorie deficit, whether it comes from a carb restriction or otherwise. So you don't need to just reduce carbs. And there's no healthy or unhealthy. Any diet that's sustainable for you is the way to go. How realistic is Casualty from Charlie Haslam? Not very realistic at all, to be honest. He's only reading his Insta stories. So I'm going questions from here. I've literally got tons of questions from here. I'm also trying to read these. How to clean the liver. The liver cleans itself. The liver cleans itself and detoxes itself. What's the difference between cardiac arrest and a heart attack from X-alpha? Cardiac arrest is basically a problem with the electricity. The electricity is turned off. It doesn't beat anymore because of the power's off, essentially. A heart attack is a blood flow issue. The door is closed. There's a blockage of blood flow to the coronary arteries causing a heart attack. They're different things. Someone is technically dead when they're having a cardiac arrest, but not when they're having a heart attack. But a heart attack can lead to a cardiac arrest. There you go. How Have you had any experience with functional neurological disorder? Now, functional disorders are really challenging. For example, fibromyalgia, etc. And sometimes they're very hard to diagnose because we're not at the stage where we have those kind of tests for them. But you need a specialist neurologist and sometimes a neurosurgeon to deal with these functional disorders. And in my experience, functional disorders are some of the hardest conditions to treat because often healthcare professionals just send away the patient saying, oh, nothing's wrong with you, and they send them away, and patients keep coming back with problems because there is something wrong. So we need to have a greater understanding and appreciation for these issues. That's my take on it. So yeah, I have sympathy for functional issues for sure. And sometimes there's so many triggers which can flare these things off. Okay, what university do you go to? Imperial College. Do you have a family of your own? So no wife, no kids, no girlfriend at the moment. I need to get that going, to be honest. CRISPR technology scope. Now, CRISPR technology, we've spoken about that. It allows us to modify genes, edit genes in utero, etc. So crazy. So yeah, keep an eye on this. Check out my Insta posts. I've done some posts on CRISPR and stuff like that. It's crazy. Why do we have a gag reflex? To stop us choking. That's the main thing, basically. Get your mind out of the gutter, guys. Come on. How does gout affect people? Increased uric acid crystals deposit in joints, causing severe pain. Back in the days, it was thought to be a disease of excess. So if you had gout, basically it suggested that you were a rich person or affluent member of society. That's because gout basically was from a purine-rich diet, increased alcohol, increased meats, cheeses, wines, etc. And you could only afford those if you were rich. So it was the disease of kings. That's what it was called. Was surgery your first choice? Indeed. GC biology is easy. It is indeed. Loads of questions. What do you think of radiographers? Radiographers are also a crucial part of the hospital team. They help to do our x-rays and CT scans and MRI scans. Very good. Is overthinking bad for you? I think so. Overthinking can be, not so good for you. We've done live for 41 minutes now. Most annoying part of my job, it's probably all the admin. I can't deal with all that admin anymore, man. I'm not lying. Cannot deal with that. Okay, let's get to some more questions. All right. Can you die from pooping? So, fecal syncope, defecating syncope. Elvis Presley thought to have died from pooping. Basically, if you've got blood flow issues and you're taking a big poop, you're basically doing a Valsalva maneuver, straining to drop the kids off. And also when you have a Valsalva maneuver that triggers and stimulates the vagus nerve, one of the nerves which also connect to the bowel, to the heart, etc., and controls the blood pressure and heart rate, can drop it further and you can have a heart attack and die. That's defecating syncope. There are a few people dotted around the ages that have died from syncope in the toilet. Where in the UK do you live? I live in the south of England, the sunny south of England, apparently. Is a blue light filter better for eyes at night, and how? So yes, a blue light filter can be good. This is why blue light from screens affect the circadian rhythm and actually decreases the melatonin production. Melatonin is a sleep hormone that's used to help us induce sleep. We need melatonin to help us sleep. Blue light blocks the production of serotonin and actually sets back your body clock and messes with with your body clock. So no screens and phones and Netflix 2 hours before bed, guys. That is my advice to you. Hardest operation we've done, we've talked about that, the 10-hour operation. Is it possible to cry to death? I don't think you can actually cry to death. It would be very hard. You'd run out of tears and you'd be dehydrated. You can die of dehydration, but you can't become dehydrated just from crying out tears, because the amount of tears that you produce when you cry, even if you're crying for hours, is not going to be enough. And you would be thirsty well before that, and you'd probably drink water before that. What happens when you swallow toilet paper? It can get blocked in your throat, and also it wouldn't be tasty, and you can get bowel blockages if you eat enough toilet paper. So don't eat toilet paper, guys. What came first, the chicken or the egg? I mean, That's a very good question, and I would say probably the egg had to come first. No, the chicken had to come first to produce the proteins in the eggshell. That's what basically. Um, what was your dream job as a kid? It's going to sound very corny, but actually being a doctor, to be honest. I've always wanted to be a doctor as far as I can remember. I can't imagine wanting to be anything else like a fireman or a lawyer or a astronaut. I did want to become an astronaut surgeon, so like be a space doctor. That's something I wanted to do, but I'm happy with what I'm doing right now. I think I'd probably be too scared to go into space. Hidradenitis suppurativa, chronic condition of the skin. It can cause skin infections. Favorite animal and why? My favorite animal is probably a dog. I used to have a dog, but I had to give it away. I had a pug named Pickles, had to give it away because I did not have the time to look after it. Can we live without our private parts? We've answered that. You can live without your balls. You can live without your ovaries. You can live without your gonads and your female bits. You might have some loss in bone density and muscle function because of the loss in testosterone and the sexual hormones. What is healthier, 1.5 liters of cola or 9 liters of Pepsi? I wouldn't say either are healthier, but 9 liters of any fluid is probably going to kill you. Tell us a little bit about your family and your hobbies, off-day routines. Good question. So, mum and dad, single kid, me, I'm an only child. You can probably tell I've got only child syndrome. I like to be at the center of attention, etc. And I'm always trying to seek attention, obviously, as only kids do, and obviously a little temper tantrum now and then. But apparently I was a good kid and I got worse in my teenage years. So that's a little bit about my family. My dad's a lawyer and an accountant, and my mum's a doctor. She's a hematologist. She's one of the inspirations for me to become a doctor. Off-day routine, I like to try and get some exercise. Lockdown has not been so good, and I've had lots of injuries during lockdown, so I'm trying to get back into the gym, put on some COVID weight gain. But exercise. I like to listen to music. I like to do social media stuff, Instagram, TikTok, YouTube. I need to actually make a YouTube video tonight and try to get that going. So those are the things that I like to do on my day off. A bit of gardening as well. I want to get into keeping bees as well. That's the next thing. So if any of you guys keep bees and have any tips for me, let me know. Slide into my DMs on Insta and let me know. But yeah, how old are you? I'm 30. I'm 30 years old. I turned 30 on the 23rd of May. Have you ever eaten food that fell on the floor? I have. I'm not proud of it, obviously, but it depends where the food has fallen. If it's fallen in your kitchen and your kitchen's clean, that's fine. If your food falls in a toilet, in a public toilet, probably not the best idea to eat it. The end summary is probably don't eat food that's fallen on the floor. That's what I would say. Any advice for a new medical student? One of my biggest regrets in medical school was not joining enough societies and being part of all these clubs, because that's where you make more friends, broaden your mind, broaden your perspectives. So do that, please do that. I wanted to join drama club when I was in uni. I didn't, and I didn't stick around for cricket club longer either. Those are things I should have stuck with a bit more. That was one of my regrets in med school. Please do that, join clubs and societies. It will be so fulfilling for you. What would happen to your body if you only drank milk? You'd probably die of some nutritional deficiency and immunosuppression as well. Is there anyone on TikTok who annoys you? Not really. Life's too short to get annoyed, so yeah. How long did it take to finish your degree? 6 years. Did you do maths at A-levels? I did do maths at A-levels. What's your favorite clothing brand? I don't really do brands anymore. I guess Nike, just comfortable stuff. I just like to wear casual stuff now. I used to be obsessed with brands and designer labels and stuff like that. No point. I just like to wear comfortable clothes now. Actually, I will tell you, Uniqlo, I do rate Uniqlo. Uniqlo makes some comfortable stuff which is not too expensive and it looks good. So Uniqlo, and I think generally Japanese brands are pretty dope. Getting a little bit. Oh, let me drink some of that water. Yeah. As you're aware, India TikTok is banned. Please code content IG. I am posting more stuff in Instagram, so check it out. I'll be in Mumbai once lockdown opens up. How many followers do you think you'll get by the end of the year? I have no idea. It would be nice if I could continue to grow at the rate I'm growing at. I don't really know. Make sure you follow me on Instagram, TikTok, and YouTube, and Twitter as well if you're on there, and LinkedIn. Make sure you share my links to all your friends and family and help, because I only like to increase medical education. Please tell all your friends and family about my YouTube. And yeah, let everyone know, guys. I would love to keep growing on YouTube as well. Oh, the same guy. Can you quit already? You're so cringe. This guy, I don't know, he follows me on TikTok and Instagram and he keeps coming out with these messages. He's a weird guy. Weird. Any information on Wolff Parkinson White syndrome? There was a guy in my uni who actually died from Wolff Parkinson White syndrome. It's an cardiac abnormality where you can suddenly get an abnormal heart rhythm and you can just die. And it can affect young people. In fact, it does mainly affect young people. Where exactly do you study medicine? Imperial College London. Do you have any kids? None that I'm aware of. Or do you study at university? Medicine. What type of surgeon are you? I'm a general surgeon. What are the causes of headaches? Various causes of headaches. Caused by infections, can be caused by dehydration, can be caused by vascular abnormalities in the vessels, can be caused by strokes, can be caused by bleeds, can be caused by nerve issues like trigeminal neuralgia. So many various causes. Opinion on getting into medicine through biomed. A lot of people do that. That's a very common career route. Did you get A grades in science or any other subjects? I always loved the sciences. I always worked extra hard. So yeah, can you start streaming games? That would be crazy. I don't actually know how to do that. Have you done a scoliosis surgery? I've actually not. I'm not an orthopedic surgeon. I've seen I'm not an orthopedic or neurosurgeon, but I've seen it done once. Have you ever done a tendon surgery? I've assisted in tendon surgery when I was an orthopedic trainee, when I did orthopedics, but yeah. Do you spend whole nights without sleeping? Is it hazardous? I have had nights where I've been tossing and turning all night and I've probably only got a couple of hours sleep, but it's not common. Sleep is one of the most crucial things to our health and it's fundamental to our health. So make sure, you get enough sleep. What are your thoughts on dementia? Dementia is crazy and we don't have enough funding or awareness about dementia, to be honest. Bethany Cook, to be honest, I've never heard of an allergy to being tired. I'll need to look into that, to be honest. I'll have a look into that. I'll definitely, and I think I'll make a video on that. Can you talk about experiences of getting to med school? I've had a lot of these type of questions. I'm going to make a TikTok about it. Are you married? I am not married and I'm currently single. What is bowel cancer? Bowel cancer is cancer of the bowel. It can be in the rectum. It can be in the colon. It can be in the small intestine. So that is bowel cancer and it's actually quite common. And we have lots of screening tests to pick it up even. Where do you live? I live in the UK. How long does it take to complete surgical training? Roughly about 8 to 10 years, depending on if you do fellowships and advanced fellowships. Is a zombie apocalypse likely? I did a TikTok video talking about how to make a zombie virus. You need various types of kind of viral traits to make a zombie virus. Go check out that video on TikTok if you haven't already. Why do I have red poop? You might be eating lots of beets. If your diet is beet free, then you probably need to see your doctor because it could be a blood and there could be various causes of blood in your stool, hemorrhoids, piles, and rarely colorectal cancer. Effects of blood group mismatching. It can lead to allergies and anaphylaxis reaction to people who receives blood that's not matching with their blood types. That's why we do blood cross matching and group and save to make sure we get the right type of blood for the right patient. Is a placebo fake if it works? Placebos, there's a lot of supratentorial effects of placebos. They have a great effect on the brain. And yeah, so they do work in some effect. It's weird. I really should do a video on placebos because they're really fascinating how they work, and sometimes they do work. For example, what's a good placebo? I'm trying to think. Let me think. Do you have to pay money for university or med school? Yes, unless you get a scholarship. Are Crocs comfy? Crocs can be comfy, but if you definitely have like inner soles, inner linings, they can be even better. Do you know Dr. Julie Smith? Yes, I'm occasionally in touch with her. We're thinking about doing some collab, and I'm hoping to do a live stream on TikTok at some point with Dr. Julie Smith. She is awesome. How old are you? I'm 30. You've done that already. Why do we get attached to other people? Probably it's an element of oxytocin release, which is the bonding hormone. It makes us feel safe. Friendship releases of dopamine, serotonin, oxytocin. Those are the three feelings we get with love, and it's probably the same things but in a different intensity in friendship as well. Oxytocin, serotonin, and dopamine. What would you be in your life if you were a doctor? Something to do with languages. I love languages. Is a blood type diet a real thing? No. Blood type diets are not a real thing. Don't believe that. Neither are pH diets, etc. Have you ever done emergency surgery? Yes, when I'm on call, that's all I do, emergency surgery. Do you like beans? I love beans. I love all types of beans. Okay, so that's the second lot. Let's get to hopefully the last lot of Q&A. Yes. All right, let's check out what these guys are saying. Are you scared about TikTok being banned in the US? So apparently it's not being banned in the US anymore. So that is good news. If you don't follow me on TikTok, go follow me on TikTok and on Instagram and let everyone know. And let's get to, I don't know, it would be nice to get to 3 million or something by the end of the year. Who knows? Maybe 100K on Instagram. Do you enjoy being a key worker from another key worker? I love being a key worker. And I love how coronavirus has, one of the positive things about coronavirus, even though it sucks, is how it brought the community together, I feel, around the world. What's your goal? My goal is to educate, entertain, and empower people on Instagram, TikTok, social media, and to just continue to help people clinically and on social media. Where do you work, city or hospital? I work in the south east of England. I work in the NHS. So what's my origin, native, and how you ended up? So I was born in India in 1990. Then in 1992 to 1993, I lived in 1992 to 4, I think, I lived in Kenya, Nairobi. And then from 94 to 95, I lived in Hong Kong for a year. I went to the Bambino School. And then in 1995, I then came to the UK. And I've been in the UK since. I used to live in London for probably around 24 years of my life in the northwest of London, and then I moved out of London to the south of England. Who is your idol? My parents are my idols. I'm not gonna lie, I love them. If I'm thinking of celebrity idols, two guys who I try to channel in what I do is I love David Attenborough and I love Louis Theroux. I want to become the David Attenborough of the medical world. That is my aim. I would love to do that. How big is your forehead? It's pretty big. Tell us something about India. So India, actually the first nose job was done in India by a saint, a guru called Shushruta. He did the first nose transplant, and Ayurvedic medicine is commonly used in lots of kind of medicines we practice to this day. Are you British? Yes. Does a big forehead mean you're more clever? No, it means that you've got a receding hairline. That's what it means. Do you know Dr. Chatterjee? Yeah, he follows me on TikTok. But yeah, all the stuff he does is pretty cool. How tall are you? Good question. I'm 5'7", so I'm a short ass. Shortest surgery you've done, removal of a small lesion from someone's skin, and took about 5 minutes. How hard is medical school? It's as hard as you want to make it. Regular studying throughout medical school rather than cramming at the end is better. My dad works at the QE. Nice. What's your daily routine? So when I'm going to work, I wake up at around 5:30 or 6 a.m. And then obviously go to work. It depends if I've got an on-call shift. And then I try to have like a very small meal at work. I don't like to have big meals at work because it makes me bloated, because I'm always up and about and it makes me lethargic. And then when I get home, I try to do a little bit of exercise, and I like to have an early dinner and then chill out for at least 2 hours before bed, and then go to bed. Do a little bit of meditation before as part of my sleep routine. Is muscle memory just a myth? Yeah. Well, yes and no. Yes and no. I need to do a TikTok video about this one. Oh man, this guy again. Will you quit now and just go do your fucking job without showing off? I love messages like this. Remember, in life, you will always get people that are kind of offended, or hate you, or annoyed for some reason. Just ignore them. Keep doing what you're doing. If you have haters, you're doing something well. So keep doing what you're doing. How much do you have to sacrifice for your job? Quite a lot. I've missed friends' birthdays. I've missed two friends' weddings last years. Yeah. Do I know Dr. Chatterjee? I do know Dr. Chatterjee, but only online. He doesn't know me. I know him. That's where you go. How old are you? I'm 30. Can an ischemic stroke cause dilated cardiomyopathy? It can do because of blood flow issues potentially. I want to be a midwife. Tell me what I should do in 8 years. Nursing school, and then from nursing school, you can branch off to be going to midwife training. Is being a doctor hard? Good and bad days being a doctor for sure. Have you been to Guildford? I've been to Guildford, but I haven't actually worked there. Why is cancer so hard to treat? Probably because we're not at the stage where we can fully kind of get rid of cancer. And there are so many different types of cancer. There's brain cancer, bone cancers, bowel cancers, liver cancers, and it can metastasize early, which means it can spread to various places. What made you start TikTok? I wanted to educate people. That's what I do. I love doing that and entertain as well. A vlog about your garden. I've done a few videos on my TikToks about my garden, so definitely go and check it out. Where'd you go to university? I went to Imperial College. Let's go for a date. Oh, I would love to if lockdown wasn't around. So yeah. Are you married? No, I'm not married. Are you Arab? I'm not Arab. Favorite book? Favorite book? Probably The Game. If you've never read The Game, go and read The Game. It's about basically I can't remember. I can't actually remember, but I remember reading that book. Basically, no, it's not The Game. It's actually a book called Shantaram. It's about an Australian guy who escapes from prison and then basically ends up in the slums of India and ends up dealing with gangsters and becomes a kind of gangster himself. It's awesome. I wish it's turned into a movie. It's awesome. Why do our feet tickle the most? Probably because our feet have lots of nerve receptors, essentially. So more sort of a spike in activity then. Okay, so I think that was the last bunch of messages on my TikTok. So definitely go and check out my TikTok if you haven't already. Guys, it's been an hour. It's been an absolute pleasure to host you and have you on here. You guys are absolute legends. If you have any further questions, go make sure you follow me on TikTok and Instagram. I'm going to post a couple more videos on my TikTok. And I need to go and do some more work at the moment. I've got lots of work to do over the next few weeks. So yeah, thank you so guys for tuning in. I'm going to keep doing YouTube lives as well. Probably not as frequent as TikToks. Maybe I'll do another YouTube live, maybe in about a month's time or something. But I do almost daily Instagram and, no, not Instagram, daily TikTok lives. So check me out on TikTok to catch me there. I've just posted a new post on Instagram, so go check it out. It's about the first person in the world who got a double lung transplant for COVID-19. Go check it out. I've loved all you guys on here. Sorry I couldn't get to all your questions. I also had to answer these tons of questions on DMs on the Instagram. So next time I have a live on YouTube, make sure you follow me on Instagram and ask me the question on Instagram, because I promised all these guys I would answer their question. Hopefully I've answered some of your questions on there as well. YouTube, Instagram, and TikTok. Oh, also before I go, I should let you guys know I've got my Sunday Shorts newsletter coming out tomorrow. I'm going to be telling you the secrets to living till 100. If you want to know that, go to my Linktree link, which is in my YouTube, in my Instagram, and my TikTok. Click on the link and subscribe to my newsletter. Sign up to my newsletter, and you can receive the newsletter every Sunday directly to your inbox. So go check it out. Hopefully this has been educational and a bit fun as well. Next time, ask me some more personal questions. I'd love to tell you more of that kind of stuff. Yes, Roger Surya, I will be posting my TikTok on Instagram, so go check it out. Thank you, Bethany Cook. Thank you, Lewis G. Thank you, Craig Milne. Thank you, Aaron Almonte, and all of you who've been tuning in and listened to me chat and just talk rubbish for the last 63 minutes. You guys are legends. I'm going to do maybe a TikTok live later on. Hemopneumothorax, chest drain needs to be inserted. It's a life-threatening condition. Basically blood and air because of a collapsed lung. Guys, I'm very dehydrated now, so I'm gonna go. Catch me on my post on Instagram and then on TikTok later, a couple more stories. Make sure you comment, like, and share. Follow me on YouTube. Check out my new YouTube video. I'm hopefully going to have a YouTube video sometime over the next couple of days, so go check it out. Love you guys. I'll see you.